This video will assess the procedures for assessing resting blood pressure. The equipment you will be using for this assessment will be a blood pressure cuff, a stethoscope, and a chair. Make sure that the blood pressure cuff fits perfectly with your patient. Make sure that you position the stethoscope correctly. Also make sure that it is on and not off. You may know this by placing the earpiece on and testing out the drum. You may twist the drum and gently tap on it to see if you can hear the light tap on the drum. Patients should be seated quietly for at least 5 minutes in a chair with back support, with their feet on the floor and their arms supported at heart level. Patients should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes preceding the measurement. Markings on the cuff will indicate where to put the blood pressure cuff on the brachial artery, and also make sure your patient has his sleeve up. Once you align the cuff with the brachial artery, wrap the cuff firmly around the upper arm at heart level. The blood pressure cuffs should be placed firmly 1 inch above the crease of the elbow. Once everything is placed, you may put on the stethoscope, press gently on the drum, see if it's on, and check to fill the cuff to 200 millimeters of mercury. Once the cuff is filled to 200 millimeters of mercury, slowly release the pressure equal at 2 to 5 millimeters of mercury per second. Phase 1 is when the systolic blood pressure is at the point in which the first of 2 or more corrective sounds is heard, and phase 5 is when the diastolic blood pressure is the point before the disappearance of the corrective sounds. Blood pressure should be measured in both arms during the first examination. Higher pressure should be used when there is a consistent interarm difference. Provide the patient verbally and in writing their specific blood pressure numbers and blood pressure goals. The normal range for everyone to be at is systolic blood pressure at less than 120 millimeters of mercury and diastolic blood pressure less than 80 millimeters of mercury. Prehypertension is marked at systolic blood pressure anywhere between 120 to 139 millimeters of mercury and diastolic blood pressure at 80 to 89 millimeters of mercury. Any readings above those numbers will be considered hypertension stage 1 or hypertension stage 2.